thank all of our panelists for their sharing. We've run a little bit long, so we want to give you a chance to ask some questions, and I'll ask all of our panelists is, in answering the questions, give us succinct and direct answers so we can invite as many of you as possible. There is one quote that we'll close this section with, and that is that there are, I don't even know who said it, but there are many things that will prolong your life, but only wisdom will save it. You know? So, questions from the audience?
Thank you very much. A lot of wisdom here today. I wanted to ask Erica if she could please give us more information on her research and knowledge with regard to brain care, which you alluded to in your talk. Appreciate it.
Cutting-edge research has shown that Alzheimer's and dementia in general is accelerated with high-carb diet. Now, we used to say we didn't know what caused Alzheimer's. We knew that there was this amyloid deposits and plaques and so forth, and we thought that was the problem. And now we realize, I say we, researchers realized that it was the result of a problem. It was an inflammatory response and of something that was inflaming the brain and causing, in some people, these amyloid deposits. Other people have dementia without amyloid deposits, and they can be for different reasons. For example, I have a few patients, and I blogged about this, who turned around their dementia when they got sleep studies and realized they were low oxygen during the night, and they were slowly losing their brain. The brain is exquisitely sensitive to low oxygen. And so if you experience that your memory loss is accelerating and for no apparent reason, your diet is impeccable, it's a low-carb diet, you're exercising, which we know now creates a hormone called brain-derived neurotropic factor, which helps make more neurons in the brain, so exercise is super important. So let's say you're doing everything right and you're still sliding towards dementia. If you are hypoxic and you do what's needed, like this continuous positive airway pressure, if you're sleep apneic, it can totally turn around dementia if you get it early enough. Also, non-Alzheimer's related dementia can be from toxic exposures, like I blogged about a woman who was sent to a nursing home because she had dementia and couldn't care for herself. Well, it turned out her house was moldy, and when her daughter realized that, who was my patient, and remediated the home, could bring the mother back, and the mother gradually got her mind back. And so some of these dementias are reversible, but the idea for all of you is to prevent that. And what makes your brain healthy makes the rest of your body healthy. And where Qi Gong comes in is Qi Gong has a very amazing anti-inflammatory effect on the whole body, including the brain. And also it helps to actually manage stress amazingly well. Many of my patients who have PTSD and chronic anxiety disorders, Qigong has helped them enormously. But what I tell my patients is don't expect immediate results. Sometimes you get immediate results, and other times you just have to rewire the brain. The brain is incredibly plastic. It will make those changes you want, but it only makes them with repetition. So with mindfulness meditation, Tai Chi, Qigong, you have to have faith and hang in there and repeat it, like learning how to ride a bicycle. Eventually your brain gets what you want. And that's exactly how I got out of my disasters, is I trained my brain. So my brain now is different than when you first met me. He called me when I first came to Santa Fe. He was looking for a personal assistant. And he also said he'd give private sessions. And I was a mess after my snowboarding accident. My brain was damaged, this time structurally. So my cognition was totally intact, unlike before. And so I was in bad shape. And so my brain became rewired from repetition, and I'm not the same person. I guess you can see that. I'm not the same person.
Thank you, Erica. Thank you very much. Other questions?
Lily.
Thank you, Lily.
And thank you. Thank you for your inspiration, and we're going to change things and move them. Thank you. I have a question about the latest research with telomeres. I'm not up to snuff. I don't know if anyone knows whether or not practicing Qigong can either, let's say you start late in life, aging nation, can it repair the ends of the telomeres or at least stop any further damage? Does anyone know? Arrest?
Inflammation in the brain.
Okay.
And so inflammation speeds up degeneration in the brain. So that's how Qigong can stop that. And go ahead.
Just one thing. Also, the greatest impact on our health is the quality of the signal from our heart to our brain. So when we're practicing Qigong, our hearts are open, right? And we're sending these positive signals to the brain, and the brain chemistry reacts to that, and floods our body with these self-healing. The body knows how to heal itself. It kicks in the self-healing mechanisms, and coherence appears. So I know that's one way for sure.
Okay. So, we all know from our tradition, from our living experience, also many quantitative study available, what's the secret of longevity, when it's really happiness and feel young in your heart feel young. The rest of the body may feel some limitation when you continue aging. As long as you keep your heart young, keep your spirit high, young, open, then you can prolong your longevity. So then another stress is continuous effect of, limiting us from living to a full potential, including health, longevity, life in general. So, but now we do have this more specific study can validate that, or telometer, or any other, biomarker to validate that. Oh, this practice can, affect in the biology measurably. Yeah, so that's exciting pieces. Yeah, actually, I have just last conference, Super Qi Summer in Omega, one of the presenter presented that information about using Qigong to change telomeres.
Wonderful.
That's specific. I don't know the detail, but I was excited. Oh, wow, great! Now more science coming out, validating this, ancient knowledge and wisdom and practice. Yeah.
And I also find your short 10-minute inner smile, the connection internal between heart and brain, so helpful and so simple. Thank you all. Thank you.
Are there any online questions?
Lots of online questions.
Okay, we have, the first question is, I'd like to ask Mingtong and everyone if it's possible to help Fa Qi to my sister Rosa. She's 62 and has fatal ALS disease, from Enrique.
Yeah. And I think you know the answer if you're practicing Qigong already. And again, La Qi is one of the best way, direct way, generating, sending, sharing the healing energy with your loved ones. So very simple movement. You can incorporate in sound to it. More importantly is your visualization. Your mind tap into the energy, connecting with your loved ones, whoever you want to share the healing energy. And that's something I recommend for everyone to do. Doesn't matter what their condition is. Really, even doesn't matter what is the cause of that condition, as you understand or not. Yeah. Everything is energy. So when you go into the energy, you can addressing all the causes, deeper causes. Yeah, you can address in the mind, body, heart, and this deeper alignment. You can connecting, affecting the function of the being to awaken into the wholeness. So in this La Qi, as you're visualizing the people in front of you, or you can visualize yourself be with them, whether in person or long distance, then you're gathering the energy from the universe. So as Robin, Chris, and many of us are speaking of the importance of connecting with the nature as a true medicine. And when we speak of the nature in Qigong, nature is everything. The subtle energy beyond just what is visible. You know, the earth, the tree, the water, the sky, that is important, but also connecting with the invisible energy of the nature. When you're connecting with that, then you don't feel the boundary between, you and your loved one. Well, any boundary. You don't feel the boundary, even in this event, its whole energy field is connecting with the entire planet Earth. So when you think of that big, then in the energy field, you can send in the energy to any place where it's needed, including yourself. So what you're learning for yourself is equally applicable for others, including your loved one, including your patients. So for the healthcare professional, one of the techniques we're going to learn and really practice so easy is really connecting that energy field in your office, in your treat room. Before the patient show up, you're even visualizing the energy is present already for them. So your job is opening their mind, body, heart to connecting with that source energy, which is the source of all medicine. That source energy is source of all health, all healing, including within, including other people, including life around you. So you can incorporate in so many ways, so many ways.
And it's also for
Speak
you.
up a little.
Hello?
You
There
just
we
keep
go.
talking and Dark
Keep
will
talking and
adjusting.
it comes on.
Yeah.
Another question for Mingtong. Is it okay to integrate practices from different kinds of Qigong, whether you learn them in workshops or reading?
Yeah, and that's a good question, and we're inviting our friends to comment in on that too. This is my personal view from my experience of what's the quality, what is the principle for you to create the best result of your mind-body alignment. So in that context, it's really better to practice one form of Qigong as one routine. You can practice another form of Qigong as another routine, not mixing them together. Yeah. So if you have more time, you say, I'm going to practice 3 routines a day or 2 routines a day, then it's okay. You can practice in different Qigong. And so you follow that principle, that guidance, okay? Then often, of course, if you have very minimum time, then I suggest you stay with one system as long as you can, as deep as you can, as consistent as you can. So you can, instead of focus on trying to do everything, you focus on what is important and do that consistently as deep as possible. And that's just my take on it. Yeah.
And a question for Dr. Robin Benson. Please explain more about the amplified regenerative therapy you do using platelet-rich plasma and ozone.
Okay. So I do this procedure where I actually extract your blood, about 60 cc's, and we get your platelet-rich plasma. So it's about 10 or 12 cc's, and I use this for sexual regeneration, so for women with incontinence or any type of pelvic pain, men for ED, also for people who want hair restoration, facial rejuvenation, and also for joints. So it's pretty awesome in that there's like no worry of any type of infection. It works very fast. It helps to restore healthy tissue, helps with circulation, and also helps with bone regeneration. So it's pretty fantastic in that way. So yeah, there's lots of ways to use amplified regenerative therapies. I also use ozone in medicine, which is pretty amazing. You also do this a little bit, but really excellent for any type of infections, that's a big issue in terms of just something that also causes degenerative issues in our body. So I'm really thrilled that I can offer all of these to my patients. And I can't tell you how many surgeries are prevented because of this form of regenerative medicine. It's great. I can attest. I keep a lot of my colleagues healthy too this way.
What?
I just have one more.
Okay.
One more question, great.
Here we go. Okay. Can your thyroid be healed? I've been on thyroid medication for 20 years for a low thyroid.
I have quite many cases. People get rid of thyroid medication, including hormone, supplement. So it's really up to us how to get into our own body, mind, heart, establish. One other way to put it is like you are having a new jump study and jump start of your system, like rebooting your system, basically. Yeah. So just like computer, when it's overused, not functioning well anymore, it's like rebooting is one of the very effective way of doing it. And then also upgrading your operating system internally. Yeah, so not only these glands, these hormone, responding to the chemical, biological aspect of ourselves, but responding to stress directly, responding to how we relating to life, and the hormone issue is also relating to your life force, the gene energy, the kidney energy. And so that kidney energy is regulating, the overall function of a glandular system. And that's not just a knowledge from traditional Chinese medicine, but it's a deeper energetic mechanism that you can tap into to restarting the function again. Yeah, it's really about deeply awakening the wisdom. It's there already inside of you, but you have to go there, connecting that, starting connecting with your body, then discover the true medicine within you.
Actually, one of the things that was a challenge for me, now it's almost 25 years ago when I discovered Qigong, was a thyroid condition. And everything changed. I really only practiced about 3 months, and I went back to the doctor and he took me off of, forget what it's even called now, but Armour thyroid and all these other things. And so yeah, it did it. It's an inside out job. And it works.
I do want to say we have a couple of things that we need to do. There's a gentleman, Tom, standing by who's going to give us a little bit of his experience with a rather remarkable experience of what's happened with his practice. I do want to say that this is not a free lunch. Qigong is not a free lunch. You have to earn these extraordinary things that everybody is talking about. It's a practice, and you will get the most benefit from the practice the deeper into the practice that you go. When you go past the barriers of limitation and pain that show up from a body that hasn't been moving quite as much and starts to move more. So I want you to know from all of us that this is not a magic bullet, 2 seconds and things go away. But all of the things that everyone has said, everyone on the panel, Zoom, and everyone here on the stage, there's enormous truth there because there's commitment and there's willingness to do the practice and benefit from the results. Tom, are you there?
I'm ready. There we go.
Wait a second.
I'm here.
Wait, we have to get your picture on the screen. Tom, we have a limited amount of time, but you have an extraordinary story. So if you can tell it succinctly, I know everybody will benefit from it.
Great. I'll be really short with my story. I was a business professional for most of my early life till my mid-40s, and then switched to coaching to try and feel better about what I was doing. and thinking that if I changed my purpose, it would feel better. But after being a successful business coach and helping people, I still got sick. And I started with a black mold infection that gave me electrical storms in my brain and made me pretty dysfunctional with my brain. So some other people were talking about that. And worked to clear that up for quite a while. Underneath that was some Lyme disease. I had been living up in the mountains where the black mold occurred and also got a tick bite up in the mountains. And this was about 8 years ago now. And started treatments through the Lyme disease, through the antibiotic treatments that are kind of typical. And that took a lot out of my body. And my whole focus, as some of the other people were referencing, was I was letting the doctors try and heal me. And I was doing everything they said, including taking the supplements and doing all that work, and just spent literally hundreds of thousands of dollars over a period of time to try and get better from Lyme disease. And then subsequent to the Lyme disease, I actually got stage 3 lymphoma. I had cancer. So I developed like a 3-stage disease process over a period of about 5 years. And my body just kept going downward. I had to go through chemotherapy, extensive chemotherapy. It damaged all of the nerves in my back and created radiating pain down my arms and my legs that was very, very bad. And I ended up at Stanford Clinic at their pain management for several years, trying to overcome that pain. I wasn't an opioid addict, but I had to use opioids to manage my pain. And Stanford had to keep upping the management levels until I was on the maximum dose of Oxycontin that you could take. And then they gave up on me and said, they didn't give up on me, they said, there's nothing more I can do for you. And at that point, I switched to, for the first time, looking at what I could do for myself directly and started doing some meditation techniques that I learned from Dr. Joe Dispenza on how to go into my body and start to learn about the relationship between my mind and my body. And that helped me start to manage my pain for the first time. And I thought I was on a good path, but then my gallbladder gave out about a year ago now. And I had to go in for emergency gallbladder surgery and had my gallbladder removed. And that kind of finished my body energy, as Mingtong calls it, the Jing. I just felt literally dead inside. And I'd done a little bit of Qi Gong before that and found it helpful. And I knew to do something very different than I'd done in the past. And going back to the doctors, there's really nothing more they could do for me. So I went to a retreat about a year ago now, the year ago June. And I went there, I had to go in a wheelchair because I was too weak to get through the airport. And showed up there and was nervous because I was only 3 weeks post-surgery when I got there. And the first few days were very hard as it's been said, this is work, and it took a lot of commitment to stay. And by day 3, I was wondering whether I should be there or not because I was so tired and struggling, but something opened up in me. And the key thing that happened, I think, in the first week of the process is I learned how to come back into my body in a way I'd never realized before, even with many years of meditation. And I created a relationship with my body and a connection with my body that I didn't think was possible, didn't know was possible. And as a result, something just switched on in me. And I've been doing Qigong now for a year. At the time, a year ago, I was on an immense number of medications for prostate, for sleep, still on methadone for pain, still on Lyrica for pain. I mean, and about another 5 medications beyond that. Today, I've gone to several retreats and I've been doing consistent practice. And now I can say that I'm driving again for the first time. A few months ago, I could drive. I couldn't drive more than about 30 to 45 minutes at a time because the vibration of the car would upset the nerves in my back and create a lot of pain. And so I was very limited in what I could do. Just getting back and forth to the doctors was difficult. Since I've been doing Qigong, I've completely reconstructed my back with Mingtong's guidance and my teacher's guidance. And I just got back from a retreat about 2 weeks ago from Tahoe, where I went 5 hours up, 5 hours back in the car with no pain. So my energy levels are amazing. I'm back up and I'm coaching again. I'm now coaching people with severe illness using Qi Gong as one of the primary things that I'm working with people on, along with just awareness techniques. And the only medication I'm on now is I am on the last little bit of I was on a antidepressant medication. I was on 300 milligrams. I'm on 75 milligrams currently, and scheduled to go off that in the next 30 days. I have, I'm on a little bit of thyroid medication and hoping to get off that. I have nothing else. I'm on no pain medication, no Lyrica. I sleep wonderfully. I do use a CPAP, as one of the doctors mentioned, and that's really helped as well. But my brain's clear. And I'm just really thankful. This practice has literally saved my life in the sense of bringing back a sense of purpose and an energy that I've never experienced before, an aliveness inside of me that I'm grateful for every morning.
Thank you, Tom. So as we wind toward the conclusion of our program, both here live at the Qi Center and also with all of you who are listening and watching via live stream, there are just a couple of announcements we wanted to make. Ilka mentioned that there's a Petaluma program at the end of July. Those dates, Mingtong, are
July 30, 31st. Yeah, I'm very excited for that.
Yeah. There's also one of the retreats that Tom was talking about will be taking place here at the Qi Center in July, and it begins when, Mingtong?
June 30, right here.
And it's a 28-day retreat?
You can stay here either for 1 week up to 4 weeks long.
Yeah.
Yeah, traditionally in China, the main prescription of Qigong is 4 weeks long as one cycle. And of course, our life is so busy here, and if you can start in 1 week, then you can continue and deepen in the practice after an extensive, very powerful change, whatever time you can invest in your own healing practice.
So here's the quote, another quote from the Dalai Lama. Man, because he sacrifices his health in order to make money, he then must sacrifice his money in order to recuperate his health. Then he is anxious about the future and doesn't enjoy the present. As a result, he doesn't live in the present or the future. He lives as if he's never going to die, and then he dies never having lived. Mingtong, do you have something you'd like to say at the close?
Thank you, George. Thank you, every one of you here, my friends here, and online, and everybody participating. And for you to come today too, it's really amazing wisdom we share today, and really discover you have the wisdom. And we're here to really engage in this experiment. It's like human experiment, way beyond any time ever happened in the history of humanity. These teaching, this wisdom being available for a long time, but have been kept secretive until 30, 40 years ago. Now it's all available for all of us. So it's up to us really how to discover what is possible for you. So sometimes people ask me, why are you so passionate about Qigong? Why are you so happy when you working with people? And they're like, hopefully today you know the reason, when you hear these stories, everybody's stories, Gab and Tom, like, how could you not be passionate about? How could you not feel so, rewarding, fulfilling in this way of life? And I feel very blessed. So our job here is really to creating a support system, make this possible. And it's really we are initiating, and I think it's continue happening a few years already, but I think we're making a bigger step. It's really a revolutionary paradigm shift of healthcare system. Yeah, shifting from symptom-oriented or disease-oriented to self-care and cause, mind, body, heart, wholeness-oriented medicine, which is a free medicine. The best medicine is within you, which is free. So now it's possible. We can discover that together. So, hao la, thank you,
Hao la.
thank you.
Yeah.